Read this. पढ़ें.
Which of the following intervention for the boyfriend is most likely to decrease the risk for disease acquisition? 26-year-old woman come to the office due to a flu-like illness with low-grade fever, malaise, nausea, and anorexia. She came back from a trip to Honduras a week ago, and her symptoms started 2 days prior to her return. The patient has no significant medical history and take no medication. She occasionally smoked marijuana and has used injection drug in the past. She has had several sexual partners and currently live with her boyfriend. Temperature 37.9, blood pressure 121 by 78, pulse 86. The patient has a scleral icterus. Cardiopulmonary examination is unremarkable. Liver is palpated 4 cm below the right costal margin and is smooth and tender. Laboratory study are as follows. Total bilirubin 44.8. Aspartate aminotransferase very high 11,222. Alanine aminotransferase 21,184. And hepatitis B surface antibody positive, hepatitis B core antibody positive. Other thing negative, hepatitis A, IgM antibody positive. Other thing negative. Acha. So which of the following intervention for the boyfriend is most likely to decrease the risk of disease acquisition?
हेपेटाइटिस ए वैक्सीनेशन हमने इसको किया था लास्ट टाइम, मुझे याद आ रहा है.
हाँ, मुझे भी याद आ रही है. ये रिपीट क्वेश्चन हेपेटाइटिस ए वैक्सीनेशन.
क्योंकि इसका सिर्फ यहाँ से ही अटेम्प्ट करना है कि IgG जो है वो इसकी नेगेटिव है. सही है. IgM इसकी बनना शुरू हुई है, नो डाउट, मानते हैं. और इसके लिवर के जो है वो हालात बुरे लगे पड़े हैं. बेहतर है कि इसके जो इसका दोस्त है उसको आप हेप ए का वैक्सीन लगा दो. ठीक है. ओके. This patient's presentation and laboratory findings are consistent with both acute hepatitis A virus infection, markedly elevated transaminases, positive hepatitis A IgM antibody, negative hepatitis A IgG antibody, recent travel to Honduras, and prior hepatitis B vaccine virus infection, positive hepatitis B core antibody, positive hepatitis B surface antibody, and history of intravenous drug use. Since the introduction of routine hepatitis A vaccination in the United States, infection rates have fallen significantly, but disease transmission remains a risk for a number of groups, including international travelers, men who have sex with men, illicit drug users, and those with household or sexual contact with infected person. Transmission occurs most frequently via the fecal oral route, although sexual and blood-borne transmission can also occur. Post-exposure prophylaxis with hepatitis A vaccine or hepatitis A immunoglobulin should be considered in a number of groups, including close personal contacts, sexual contacts, household contacts of hepatitis A infected patients, child care center contacts, staff and children, where staff, children, or household contacts of attendees have been infected, food preparation workers whose co-workers have been infected. Prophylaxis should be given within 2 weeks of exposure in general. Younger patients aged less than 40 or age less than or equal to 40 should receive hepatitis A vaccine, whereas older patients age greater than or equal to 41 should receive hepatitis A immune globulin. कह रहा है कि जो प्रोफिलैक्सिस शुड बी गिवन विद इन 2 weeks ऑफ द एक्सपोजर. इन जनरल जो यंगर पेशेंट होगा उसको आपने हेपेटाइटिस ए वैक्सीन देनी है, जबकि जो आपके ओल्डर पेशेंट होंगे उनको आपने इम्यूनोग्लोबुलिन भी देनी है, यानी एक्स्ट्रा सपोर्ट देना है, या इम्यूनोग्लोबुलिन ही देना है. ठीक है. क्योंकि ओल्डर पेशेंट में इम्यून के कॉम्प्रोमाइज़ होने के चांसेस होते हैं. ठीक है. आपा हेलो.
Okay,
ओके.
I'm here.
हाँ, गुड गुड. ठीक है. Although sexual transmission of hepatitis A virus may occur occasionally, barrier contraceptive use alone would not provide adequate protection against the most common route of transmission, fecal oral. This patient's viral markers imply previous hepatitis B infection, core antibody with resolution of surface antibody with resolution that is shown by surface key antibody, making further vaccination and treatment for hepatitis B unnecessary. Post-exposure prophylaxis with hepatitis B immune globulin and vaccine would be administered to a patient with percutaneous or sexual exposure to an individual with positive hepatitis B surface antigen. Post-exposure prophylaxis either with hepatitis A vaccine or hepatitis A immunoglobulin should be considered in a number of groups, including those with close personal contacts, sexual contacts, household contacts with infected patients. वायरल मार्कर्स ये वाले हेपाटाइटिस बी सरफेस एंटीजन क्या शो करता है? हेपाटाइटिस बी सरफेस ग्लाइकोप्रोटीन detectable during acute infection, persistence greater than 6 months, chronic infection. Hepatitis B viral polypeptide detectable during acute infection indicates increased viral application and infectivity. Antihepatitis B IgM detectable during acute infection, present during window phase. Okay. Antihepatitis B core antigen, not antihepatitis C. Okay. एंटीहेपेटाइटिस बी कोर एंटीबॉडी जो आईजीएम वाली है वो विंडोज पीरियड में भी होती है बिटवीन हेपेटाइटिस बी सरफेस एंटीजन एंड एंटीबॉडीज. ठीक है. एंटीहेपेटाइटिस बी सरफेस जो एंटीबॉडी है seen with a cleared infection or vaccination confers long term immunity. एंटीहेपेटाइटिस बी का ई जो एंटीजन है या ई जो एंटीबॉडी है डेवलप करती है इन क्लियर्ड इन्फेक्शन एंड लेटर इन क्रॉनिक इन्फेक्शन इंडिकेट्स डिक्रीज्ड वायरल रेप्लिकेशन एंड इन्फेक्टिविटी. जो एंटीजन था वो वायरल रेप्लिकेशन के बढ़ाने को बताता था, जो एंटीबॉडी है वो कम को बताएगी. एंटीहेपेटाइटिस बी कोर एंटीबॉडी IgG वाले जो है present in both acute and chronic infection, not present after vaccination, not present after vaccination, not present after vaccination. सही बात है कि कोर की एंटीबॉडी तभी मिलेगी जब आपका इन्फेक्शन हो चुका, जब आपको इन्फेक्शन ऑलरेडी हो चुका हो. ओके.
Next question.
हाँ, नेक्स्ट क्वेश्चन.
ज्यादा हाँ. Okay, which of the following is most appropriate next step in management of this patient fever? Chest X-ray reveal decreased lung volume and a small area of subsegmental thickening bilaterally. Acha. 48-year-old woman come to the office for elective cholecystectomy to treat symptomatic cholelithiasis. She has had increasingly severe intermittent biliary colic pain. Ultrasonography reveals several gallstones. The patient has a history of hypertension and obesity. Preoperative medical evaluation and laboratory testing were unremarkable. The patient received cefazolin for surgical site infection prophylaxis and surgery is performed under general anesthesia. A Foley's catheter is placed preoperatively. The planned laparoscopic procedure is converted to open approach due to difficult anatomy. Otherwise, the surgery is uneventful with minimal blood loss. 2 hours later, the patient is noted to have a temperature 38.9, blood pressure 140/85, pulse 104, respiration 18. The patient is awake and alert but report mild pain at the surgical site. A right-sided internal jugular catheter, venous catheter, which was placed in the operating room, is in good position with no redness at the insertion site. Lung are clear on auscultation and heart sound are normal. Surgical site is clean with minimal serosanguinous discharge. There is no lower extremity edema. Hemoglobin 10.4, platelet 2,40,000, leukocyte 14,000. अच्छा, neutrophil count high 80%. Sodium 136, potassium 4.4, bicarbonate 26, and creatinine 0.8. Total bilirubin 1.3. Alkaline phosphatase 70, SGPT 37, SGOT 37, SGPT 49. pH 7.4, O2 partial pressure of O2 86 and partial pressure of CO2 34. अच्छा, decreased lung volume and a small area of segmental thickening bilaterally. अच्छा. Now they are asking which of the following is most appropriate next step in management for this patient
सोचने दो.
fever.
ठीक है, सोचने दो.